Hello and welcome. We're happy to be here and we hope you will come and join us. It's a beautiful day here in Maine. The scenery is unbelievable. I can just sit out in my yard and just look, and I can see yellow and orange and red and white and tall trees and leaves on the ground and a blue sky, and the wind is blowing just a little bit, and it's just beautiful. It's unbelievable. It's like a picture. And it'll make you happy if you do that. It makes me happy because I can't believe what I'm seeing. And for today, I would like to say that if someone told me I had breast cancer, I don't know what I'd do because I don't understand breast cancer and I don't understand vocabulary that's medical, and I would be scared to death. So it's not as bad as it seems. And I can remember the days when we didn't even say the word cancer. And I'm so proud to say today that I have ladies here that are going to talk about it free and openly and help us to understand. And men and women both have cancer. And there was a lady in here doing a show before me, and I was talking to her, and she said horses have breast cancer. Now, I didn't know that. But today we're going to talk about human beings, and we have some lovely ladies who are going to inform us. We have Holly. I'll find it here. Excuse me. Dr. Holly Coda. She's a survivor and president of the Susan G. Komen, Maine affiliate. This is Holly.
Hi there.
We have Rachel Damaris. She's a survivor and buddy with the Cancer Community Center.
Yes.
And we have Helene Langley. She's an RN, certified patient navigator for breast care at Southern Maine Medical Center. And now, Holly, would you share some of your experience with us?
Sure, but first, Zaffie, I'd like to thank you for inviting us all on your show today, especially during Breast Cancer Awareness Month. And I know in all of our respective organizations, we're just very happy to be able to share with you today and share with your audience a little bit more about breast cancer and some of the resources that are available here, right here in our local area for women and men who have received a diagnosis of breast cancer. As you mentioned, I am a survivor myself, 11 years now. And going back to our earlier show where I shared some of my experience, I'll just reiterate that a little bit more and to sort of set the stage for the very important work that both Rachel and Helene are doing in this area. 11 years ago, I was diagnosed. It was very, very unexpected, totally unexpected. And my first response was, oh my, I need to find out what's this all about. What am I about to face? All of a sudden, I needed to have a lot of information about, what is breast cancer all about? What is the type of breast cancer that I have? What are my treatment options? Am I going to live? I was scared of the cancer word too. Thank goodness there's been so much, very positive research and there are so many resources out there now that I was able to take advantage of. But at the time I first heard the word diagnosis, I didn't know what I was up against. I wanted to find out information. I also wanted to find out from other women who had actually walked that path, what am I up for next? What's it really like to go through these treatments and such? So all of that said, I look at Helene, who's the patient navigator, and she's also a nurse. She'll tell you about what she does. And Rachel is with the Cancer Community Center Buddy Program, and she provides a lot of support to women and men who have received that diagnosis and they need someone to help to walk the path. I must say that was just essential information for me. When I had the opportunity, I didn't have a formal buddy like Rachel is, not at that time, but I reached out to people that I knew in the community that were willing to speak with me and share their experience. And that was so helpful as I began my own personal journey with breast cancer. That said, we all want to know information, we all want to know what we're up against, but it's very different for every different woman. So with that,
Everybody's different.
yes,
For sure.
in our
You
experience.
must know that.
Yes, most definitely.
Would you
Most
tell
definitely.
us what you do?
Yes, I'm what we call a nurse-patient navigator, and I'm located specifically in the breast center at Southern Maine Medical Center. And when we started this program, it was inexistent at the time, and I was new to it as well. And I had written up a proposal at one time because I truly believe in the navigation concept for patients. I felt that that was very important for
It is.
patients, and I was so happy that I was heard somewhere at Southern Maine, and they brought me on board as the first nurse patient navigator in the breast center. So I began the journey there about 2.5 years ago, and I've been a navigator there for that long. I am located in the radiology department. Navigators are utilized in various ways at different hospitals. At Southern Maine, I am located in radiology, where I meet with patients when they are told they need a biopsy. So I'm in there with them at the time of biopsy, and I follow the results very carefully, and then I'm able to be there for them at the time of diagnosis. So I watch those results. If they're positive, I have them come in. I'm not allowed to provide any positive results over the phone. I have them come in, and I have a certain amount of time that I set aside. It takes usually about an hour. And I provide them with all of the tools. I go over their biopsy pathology report, and I think it's a wonderful opportunity that is given to have that time with them. It's a time that is very highly anxiety prone, of course.
I know I treasure it.
Yes. Yes, and the women, you know, when they find out, it's devastating, of course. But even by the time they leave my appointment, they feel a little bit better. They have a handle on where they're going to go next, and what's coming, because that's part of what I do with them. Is I go over the steps in the treatment, and I'm also will be accompanying them to that first consult with the breast surgeon, so they know they will be seeing me again at that appointment. And it just makes things very nice.
That's good that you go with them, because a lot of times when people go to the doctor, they're so nervous and they don't know what the doctor said.
Oh,
Exactly.
absolutely.
I wish that I had had someone like Helene when I went through my experience. I didn't. They were not patient navigators at that time, and I went through the biopsy experience all by myself. No one would say a word to me.
Right.
And I'm thinking, I was scared to death, and I'm thinking, oh no, like, what next? And I didn't even have anyone to ask any questions to. Fortunately, Helene has the clinical background, as well as really an understanding of the resources at the hospital and the healthcare system and in the community. If I had had that kind of information, it would have been so helpful.
I think silence is the worst.
Yes, I
No matter
certainly
how
agree.
bad it is, if a person can understand it, they're better off. Don't you think?
Oh,
Absolutely.
absolutely.
Knowledge is power.
That's right.
It certainly is.
Yeah.
That silence just, ooh. Because I have an imagination, so I have to
Oh,
know.
yes. Yeah.
Yeah, what was it like for
When I
for
was
you,
diagnosed,
Rachel?
I was, waiting for the phone call to get the results from the radiologist. And I was at work, and, you get that at work, and you're like going, oh my gosh. I left right away because I couldn't handle it. I didn't, I actually ran to my PCP office, who had nothing to do with anything, but I just didn't know where to turn. I was like, oh my gosh, I was just diagnosed with breast cancer, and I couldn't believe it. And, from there starts the roller coaster ride of where you go. And the type of person that I am, I did go out and seek the kind of thing that you provide now, where I went out to the Cancer Community Center and started joining their support groups because I needed to hear from other people. I needed to find my own buddy, so to speak. I never formally received my own buddy, but I went to those support groups every other week, and they were wonderful. And when I went into my breast surgeon's office, she handed me a book that I read cover to cover to get my knowledge of what I was going to be facing, because I didn't know. I had no idea. So what you do is awesome. And I wish every facility had that. I mean, I'm 7 years out now, so I don't know if that's what all of the hospitals are moving towards, but
They are.
they are. That's
They are.
wonderful. That is a wonderful.
Although they vary in what they offer. For example, in Portland, they do have navigators up there, but they're not in with the biopsy. So they just vary
Yeah.
in what they can offer.
Yeah.
And so how did you stop being a buddy?
So after I went through all of my treatments, and I went through the buddy program. Like I said, I was involved at the Cancer Community Center to the degree that I was going to the support groups. And I started, getting their newsletter every month, bi-monthly, and saw the program, and I thought, I know how important the support group was for me, and how important it is to speak to somebody else who has gone through something similar to what you've gone through. So they offered. I had talked to Yanni, and at the Cancer Community Center, and once you're a year out from treatments, you can go through the training program that they have, because everybody in the program is trained, so they have that knowledge of how to handle situations. And I went through the training and then started with buddies, and it was because it's so rewarding. It's so, I mean, you can listen and understand, and it's so helpful to the other person who was just diagnosed to know that you get to the other side. It's awful, because the question you ask is, am I going to die? And you automatically, for some reason, those negative thoughts, the conversations that you have in your head, you end up going to, oh, this is terrible. And you create all these scenarios in your head where if you're talking to somebody who's been diagnosed, similar to you, with the same kind of thing, and you see that they're living a healthy, normal life, that you get to the other side, it's very encouraging, and it builds a lot of strength in you as you go through your journey. So
I imagine everyone you buddy is different. They're the same but different.
absolutely, everyone is different. My first official buddy was an older woman who was diagnosed and had family, and she had a positive, very positive attitude. And they all do vary in regards to length of time that you work with them as well. I worked with her through all of her treatments, spoke with her once a week. Another buddy I talked to, it was more of a decision. When I went through my treatments, I was going to be given really harsh chemo treatments, and I work with numbers. So I had my first treatment, I went to my office, and I looked at that spreadsheet and was like, oh, this isn't going to work very well. So I had a big decision to make about whether or not I was going to work or not. And socially, the word you hear out on the street is, oh, I had chemo and I'm back to work the next day. So to make a decision that I'm not going to work during these treatments was really big, and it was really hard. And my my chemo nurse looked at me and said, "You have every right to not work because what you're going to be facing is really hard." And this was just after the first one. I had 7 more to go. So, so one woman, one of my buddies, had to make a big decision, and so they connected with me. My most recent buddy was a woman who my sister was diagnosed 2010, so 3 years ago, and she ended up passing away in 2012. And this person's brother was diagnosed with stage 4 cancer and was very far away. And so Yanni connected, the fact that it's really hard to watch your sibling suffer. And in her case, it's her brother. So we had a 15, 20-minute conversation. She was so thankful. And that's all it takes, really, to listen and just show some compassion and understanding, and you can move on. You can make that connection, and it gives you that strength. Again, it gives you that strength. I remember when I used to go to the support groups, I would walk out of that meeting every time feeling stronger and feeling like I was the luckiest woman in the world, because what I was going through was nothing compared to what some of these other women had to suffer through. So that gives you inner strength that you don't realize. And
Now, most of your buddy conversations, do those go on by phone or in person, or how does that work? If a woman wants or needs to have a buddy,
yes.
I was thinking that.
yeah,
Yeah.
what does she do?
Can they call you at any time?
So what happens is Yanni will hook us up. She'll call, a buddy and say, "Do you think you could do this and fit it in?" And then we make the initial contact with the person. And from there, from that initial contact, you decide what's going to work best. Like in my first case, it was all over the phone, once a week or towards the end, it was more like her treatments after she had her treatment, or there was 2 of them that I met face to face, but it varies. It really is whatever kind of person they are, and what they want to get from their buddy program. So if they want to just talk once a week, if they want to do email, if they want to socialize and do lunch once a week, you don't do everything that they're requesting. You kind of work out and bargain what it is what's going to work best for the both of you, so that the relationship can build and both of you can get what you need from that relationship.
Wonderful.
Great.
Yeah. So it varies, but it is very
That's
rewarding.
wonderful.
Yeah.
I think so too.
Now, Helene, you were saying that you actually go in and you're accompanying people through the process of a biopsy and such. Once you get the results of your biopsy, there's all sorts of medical terms that you have to deal with. And for most of us who are not clinical people like you, it's a whole new world. Are
Yes.
you able to help, or do you help women through that part of the, making the decisions about what's next in terms of their treatment? And
Most definitely, most definitely. I think that's actually one of the biggest roles that I have, because when they come in to see me, I usually go over what's coming your way. I have a list of the next steps for them, and I make a huge point of going over that, because I actually want them to see that they'll get over this hump. This is a big hump that they have to go over, and it's going to be a long road, but they will move on, and they'll have a life after, and I think that's the biggest message that comes out of that initial meeting. So I do go over the various options. I describe the terminology. I do a lot of that work with them at that time. And then I have an open door policy, in the sense that they can call me if ever they want to meet again, or they have a family member all of a sudden who's very concerned and would like to have some discussion. I have them come in with the patient, and we can talk some more about the results and the pathology findings. And it has worked tremendously. It has really empowered the patients, I find,
How could it not work?
and helping them
Yeah,
through this.
wonderful.
For sure.
You bring up a good point about the caregivers, the people that, when you tell your spouse or your children or your sisters and brothers and family members that you have cancer, their world is affected as well.
Most definitely.
And it is so important for them to get help as well. And the buddy program is not just for patients. It is for caregivers and for people who have lost loved ones. They provide an amazing support team for everybody affected by that word.
That's wonderful.
Yeah, yeah.
I was familiar with the buddy program for patients. I didn't realize that you were matching up for caregivers as well.
Yes, we have caregivers and we have people who have lost loved ones.
Wow.
To the degree that, like I was in with my latest
That's right.
one, because not that she's lost her brother, but at stage 4, the hope is smaller, and you go, how do you prepare for that?
That's
How do
right.
you, so there's a lot of, it's not just about the person going through it. There's a lot, and all of the programs are free for anyone that is affected by cancer. So whether you're the patient or the caregiver or just a loved one, I mean, you don't have to be an everyday caregiver for the person. I mean, you could be an outsider that just needs to know how to talk to them, or how
There's
can you.
so many emotions people go through.
Absolutely.
Definitely.
What you are.
Sure.
That's right.
And it's important to have the right support around you, because there's actually studies that show that if you have the right support and your distress level is managed, that your outcomes are better. So it's very important.
Yes.
I imagine it depends upon a person's health anyway, their immune system
And also their circumstances. I've had women come into my office to learn that they have a cancer diagnosis when they're going through a divorce at the same time, or they're losing their home, or losing their jobs, or so there's many circumstances where the cancer is just piling on to something that's that's
Stressors.
bigger too.
Now we have one of the big sources of stress for many people is just wondering, do I have insurance? Can I afford, to go through the treatments and all of this? Do I have transportation available? Do you have any? Do you have connections to some of those community services, or can you help women to access
Most
some of those?
definitely. Part of that initial meeting where I was mentioning that I meet with them for an hour is asking them what they have for insurance or for resources, and what their deductibles are and everything else. And if there's any concern, we have at Southern Maine Medical Center a free application for free care. And our parameters are quite good, and they're also, it's not all or nothing. They'll provide either free care or certain discounts depending on the income level. So we do have that. I have a financial counselor that I can hook them up with. We also have the Maine Cancer Coalition that I work very closely with them in helping women who have high deductibles, for example, or things like that. So we do have, and what's nice about it is I tell them right away, it's from that first meeting when they find out about cancer, I'm assessing that right then and there, and able to not send them home and then start worrying about it. We really try to tackle that piece right away
What a
from
big
the
help.
get-go. Yeah, but
Fantastic.
transportation, though, is a huge issue. That is an ongoing issue for I think all the patients in Maine, and I think that is a challenging area that we got to keep looking at.
One thing I think, you're right on to something with the transportation, especially in a rural state like Maine. It's not as if we have public transportation, and in many of the rural communities in particular, But I think one important thing for women to know is that there are a lot of services available. We have a lot of state services, and Helene just mentioned the support available through the Maine Breast and Cervical Cancer Program, which is, if you qualify for the guidelines and someone like Helene would help to make that assessment, then there are financial resources to help you. So we do have a lot of statewide resources available to women. Some of those are on our website, on the ComanMaine.org website. But a lot of the resources that are available to women and men in the state really happen at the local level in our local communities, and there isn't one place that you can go to sort of find out what's happening everywhere. That's why what Helene is doing is so important. And I know that Rachel's program, the Buddy System, because a lot of it goes on the phone and such, it is a statewide program, so women, even if they are in a rural area, shouldn't feel that they're going through this alone. That was one of the really difficult things for me in my own experience, my own journey with breast cancer, is just feeling very isolated and alone. And having programs like these are just incredibly valuable. The work you do is just so important.
It's like therapy.
Oh, absolutely.
Yeah.
Definitely.
Yeah,
Very
it's
therapeutic.
support that is needed at that critical time of diagnosis and then beyond.
And it's so wonderful to go through it. You know, when you're going through it, it's a very traumatic experience. I remember just thinking, one day at a time. I'll do what, I'll just go through it one day at a time. And sometimes it's hard to see what life is going to be like a year out or 2 years out. But when you have a buddy or you have someone that you can speak to who's been there, then you see, gee, she went through it and she survived and she's looking really good.
Yep.
I wonder what her secret was, or what does she know that might be helpful for me as I'm going through this.
That's the unknown.
That is the unknown.
Yeah.
Yeah. One of the things that I think is really important is that you follow what you believe inside. Follow your heart, because like you, that whole feeling of alone, when I was diagnosed, I had no clue. I hadn't talked to anybody. I didn't know, in my circle world, there was nobody that I could connect with that had
And
anything
back
similar.
then, well, maybe further back then, people did not say they had breast cancer. You didn't even breathe that word.
That's right. That's right.
That was a secret.
Yeah, that's right. And even today, there are people that don't want people to know that they have cancer.
Oh my goodness,
You know,
definitely.
Yeah. Oh, yeah. So that's why I say follow your heart in what it is that is important to you. Like losing my hair, I could have cared less. I mean, I didn't go out and get a wig. I didn't go out and they have a beautiful class at the Center for Feel Good, Look Good, all about taking care of yourself when you're in public. For me, that wasn't important. For other people, that's so important. So for myself, because I was in that alone state, I knew the type of person that I was, that I needed to talk to somebody about it. And when I saw this pamphlet in one of the doctor's office and said a support group where I can talk and share and get somebody else's opinion about
Hold
what
your
it's like.
pamphlet up in front of you like that.
Like that?
Tell us a little bit about the pamphlet. What's in there?
So this is a bi-monthly calendar that comes out from the center. And it provides, every time they have someone new, this happens to be Kevin Williams, and he lost his sister to cancer. And so you get this in the mail. It provides you with lots of information. Inside, it'll go over a quick overview of what's going on, what's happened, some information. In this case, it tells you all about the center with the 13 different support networking groups, all the classes that they have, and then a little blurb article about the person on the front. Inside, you're going to have your two month's worth of calendars activities, which they are busy, 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 and it's all volunteer work. I think they have a staff of 7 or 8 within the office that run it, but they have reds and blues to signify if something's in red, you need to call and make an appointment because that's going to be a class that'll probably sell out quickly. So you have the 2 months worth of activities, and then you have the description of all the activities that are going on. The support groups themselves, what the activity is looking like, and there's some that are bridging, which are for people that are post-treatments, and there are some for the support groups that are people that are going through treatments. And then it tells you, I believe it tells you what's coming up and what's going to be, some highlights of what's going on.
Now, where is that?
The Cancer Community Center is in South Portland, right on Main Street. Yep. And they've served over 1,200 people from New York County community, and about 12% of them 12% of them have had buddies. So it's a good amount for the York County.
Amazing.
Yeah,
They have
it's a
that.
wonderful program. Yeah, since 1998 they've been around. Started by a woman who was diagnosed with cancer herself, and they have a beautiful facility in South Portland where they have all their support groups. They have a nice living room area where they used to have all of their exercise classes, and now they have a nice big exercise studio. So they've expanded,
Nice.
and it's really nice.
Oh, great.
Yeah, yeah. So.
So one of the information that I provide to patients is, of course, important websites to go to, and the Komen is on my sheet, and the Cancer Community Center is on the sheet as well. I inform them of all the activities and things. I do have quite a few patients, though, that they find going up to Portland is a ride. They would rather stay within their community. So I did start a support group. I've been doing it from the get-go, and it's the breast cancer survivor support group that I facilitate with a survivor with me, and it's every other Thursday from 5:30 to 6:30, and I have dates. The next one is going to be Thursday, November 7th, and it takes place in the Weber building at the hospital in the second floor conference room. You don't need to register. Folks can just drop in. It is for women and patients. We do, I'm planning to do it at some point where we have more of a, for example, in December, I'm planning to do a little holiday celebration where family members and spouses and partners can come. But I find that at this time I can only accommodate for patients. But
What kind of a format, if someone was to come to, a support group that you're running, what would they be? What could they expect?
well, I try to use the support group for various purposes. One is just a support group where we share, similar to a support group that you've been at the Cancer Community Center. But what I like to use the support group as well is to provide survivorship classes as well. So I will have periodically social workers that'll come and talk about fear of recurrence or various topics. I'll have nutritionists. I have a nutritionist that comes periodically that talks about nutrition and what to do. A lot of women complain about gaining weight with breast cancer. They struggle with their weight, so we talk about various ways that can help them maintain a healthy weight. I also have another individual that has come, another social worker that has come and talk about ways to handle stress, daily stress handling, coping mechanisms. I've had an individual come and talk about, there's trying to think of her name now. She's not an alternative medicine, but a complementary medicine nurse practitioner that works out of Portland that has come and talked to the group. And just actually on November 7th, I have an individual that's going to come to talk about being more aware of the things that you use normally at home for cleaning products and personal care products, things that could be helpful in trying to eliminate things that could be toxic. So it's just all these different topics, trying to mix that, because
so many things.
correct, because unlike the Cancer Community Center offers absolutely wonderful classes, and I wish we could do the same, but we can't. But we're trying to do it. There's also a class that we offer, and I don't facilitate that. It's an exercise group for cancer survivors, not just breast cancer, but for cancer survivors. So we have an exercise group. We have a macrobiotics class as well that is offered, and we do, there's another class that we do, there's the exercise, the Look Good, Feel Better program is also offered at our hospital. I encourage folks to they can contact myself or Peggy Belanger, who was just hired as a second navigator at our hospital. She is going to be the navigator for the other cancer types. So I would encourage folks to reach out to us.
I have a friend, she had a hysterectomy, but her arm or her shoulder or something swelled up. And she said that happens?
Yes, yes. Lymphedema, and when we're talking about the removal of any kind of nodes that occur through surgery, it puts an individual at risk for lymphedema. And basically it's swelling. And when we're talking lymphedema, it's more related to breast cancer. It's more related to the arm usually. And if in the past, in surgery, you used to remove all of the lymph nodes associated with the area of the breast. And the risk of lymphedema was very high. And basically when you're thinking of the lymphatic system, it's a system that filters things through the body. It's part of our immune system. So usually one of the routes where cancers would spread is through the lymphatic system, which is why we end up removing some of those lymph nodes. It helps us stage and helps us treat patients. And as I mentioned earlier, in the past we used to remove all of those lymph nodes. And by removing the lymph nodes, we're severing some of those hoses of the lymphatic system. So it makes women more prone to swelling of the arms, simply because if you think of the concept of if you injure a leg or yourself, you're going to have swelling. It's part of the immune system. The lymph is sent over there, and it brings tools to help repair the area, and there's swelling involved. And then once the area is repaired, that lymph is reassimilated. But if you think of that concept in the arm where lots of lymph nodes have been removed, if you have anything that could cause lymphs to go in there, whether it's an infection or a situation where the lymph goes in, if you've severed all of those hoses here, it can make it difficult for the lymph to be reassimilated, and puts women at a higher risk of lymphedema. So we call it lymphedema precaution. It's part of our education that we do, that I do that with patients at the hospital, educate them on being very protective of that arm. But I will tell you that the risk nowadays has decreased significantly, because we don't automatically go in anymore and remove all of those lymph nodes. We do what we call sentinel node biopsy, which helps us identify the most important lymph nodes for the breast that's in question. So we only remove usually 1, 2, or 3 nodes. So the risk of lymphedema is greatly decreased, although it's still there. So we still do our education on that and make it a big part of their care.
In my case,
That's interesting.
it is very interesting, and I just had a conversation with a friend about that in regards to when I was diagnosed and they did my surgery. I just had a lumpectomy. They did remove the 3 sentinel nodes, but then one of them was positive.
Okay.
So they went in and took out a patch.
Correct.
So do they still do that?
It depends on the stage.
Okay.
And that's usually discussed with the medical oncologist. He'll review everything, and if it's at a stage that is, I think it's higher than 2, you know, if you're higher than stage 2, then you would, yes, they do.
Yeah.
Now, I know that when I went through my diagnosis, there were a lot of choices that I had. It wasn't always a clear cut, this is the direction that you should go. I could make different choices. I had a lumpectomy also, and then I had the choice of, you know, do I do radiation? Do I do chemotherapy? Do I take some other drugs and medication? And I really went through a lot of thinking myself, and I reached out and had a chance to talk to other people and online, but that was a pretty confusing process because you know, the research does change so frequently, and we're learning so much. You know, you want to have as much new information as you can to make your decision, but even so, some things are not always as clear cut as they appear. Do you, in either of your programs, help women to come to terms with some of those, what we'd call gray area choices?
Well, I think for me, in a sense, being more in the front end and not being a physician, you know, I let patients know that we are an accredited facility. We actually just received our accreditation. We've had our cancer accreditation for several years, but we've now have our breast cancer accreditation, and so doesn't Maine Medical Center, and Mercy has their breast accreditation. And in order to be accredited, we need to follow certain guidelines. And basically the guidelines are very specific in terms of what standard of care is offered to women, and it's quite surprising at how specific those standards are. So the gray areas have kind of diminished in a sense, especially with centers that are accredited. We're supposed to follow certain guidelines, and those decisions really come together where either the surgeon or the oncologist meets with that patient and says, this is what's the standard of care, this is what's recommended for you. Let's look at, you know, what are your other comorbidities, what is your situation, and then let's make a decision as to what is best for you as an individual. And I've found that has worked very well for us at Southern Maine Medical Center.
So you often will help to support a woman in understanding what the
Correct.
physician is saying and helping to come to that decision herself.
Exactly.
Okay, great.
And I would say we stay clear away from that in the center and support groups. We listen to what people have.
That's right.
Because, you know, we're there to listen to them and be compassionate and empathetic with what they have for a choice to make. But we are not to give, I mean, we're not giving them advice as to what they should be, because we don't have the medical, there may be medical people within the group, but it's not something. At the beginning of each group, there's an acronym that they use, which one of the items is that you don't give advice.
No advice.
Because we're not right.
Which is
We're
what
not
I
medical
do
care.
as well at the support group.
Yeah.
too.
Right.
Yeah. So,
Both pieces are so important. I mean, you want to know clinically what's going to happen. You want to know sort of emotionally and
Right.
psychosocially what's going to happen.
It's so much to
Bringing
think
them,
about.
Right.
knowing we have resources from both of your
Yeah.
programs is just so important.
to be able to listen to them and, empathize with the fact that they have such a big decision to make helps them feel better, I think.
I think
to,
so,
to the
too.
degree that they have a really hard choice to make. And whatever they make for their journey is the right one for them. We sat through one of the support group meetings one time, all of us, I think there were like 10 of us in the group that night. And this one woman came in and she was given her diagnosis, and pretty much all she had to do at that point, she had found out she had to have radiation. She didn't want to have it. And all of us were like, the eyebrows go up, but that's her choice. And so once we were all over the initial shock of it, you go, okay, if you're comfortable with that, and that's where you have to encourage them.
That's right.
I mean, because they're all tough decisions.
Yes.
There's not an easy decision in the whole process. And so if somebody is at least making you feel stronger about what you're going to decide and how you're going to do it, that makes a difference. And it gives them and it empowers them, I think, to move
It
forward.
does,
Yeah.
because they have to know
Right,
what that's going to do.
right. Yeah,
I would have to
Yes.
know.
Oh,
Yeah.
yes.
yeah,
Most definitely.
yeah.
I could use all of you if I had breast cancer. I hope not.
Well, I
hope
hope
not
you
either.
don't have to go that journey either, but, we're all here
We're
and
all here.
available for you, so.
Absolutely.
I'll
we would
remember
put-
that.
Okay.
Thank you.
Definitely.
For you, what's the biggest challenge in your job?
In my job with Komen,
Yes.
well, again, we don't tell people what to do. What we try to do is make available community-based education and information. We're like a convener of resources. We like to know what's going on. Also, through our races for the cure, we develop 75% of what is raised by our races goes to a community grant program. And we actually have a community grant program. We're accepting applications right now. We are a statewide organization, and I think that probably my greatest challenge would be wishing we could do even more, because we do a community assessment at Komen where we really look at what are the needs around the state, and we collaborate with a lot of the different breast cancer organizations that are contributing so much around the state to find out what are the gaps in care, what is needed, what we're finding. And what we support with a lot of our grant programs is that transportation is a very big issue, particularly in rural areas of the state. And we do have some grantees that are providing some very helpful transportation programs. But as I said, there's so much need. I wish that we could provide even more. And Maine is a very large state. I always remind myself that all the other New England states could fit within our geographic radius, and just making sure that every woman and man and their families know that there are resources and people who care about them. There's just so much more always to be done. We've made incredible progress, and where Komen makes a lot of our progress is by working with our grantees and with community organizations like the Cancer Community Center, like Southern Maine Medical Centers, that are doing so much, in their communities. I just mentioned that 75% of what we raise from our races for the cure goes to community programs right here in Maine, not outside. The other 25% goes to advance research on new treatments, on psychosocial needs of women and such. So I just wish we had even more resources to make available to people who are going through this experience.
It's a lot.
It is a lot. It is a lot.
Most
But
But
you
it's
know,
all good.
what is wonderful is to see how many community-based organizations there are across the state who are just making incredible strides trying to help women, men, their families in their communities. What you're seeing here is our microcosm here in here in the Biddeford, Saco, Old Orchard, and the Greater Portland area. We know most about that, but again, Maine's a big state, and I'm very happy to be able to report that there are a lot of organizations throughout the state that are just as committed to making sure that men and women know what's out there for them. And
It's great.
yes,
Yes.
It's wonderful.
yes.
It's good to know.
It's good to know. Sometimes you have to search out some of the information in the local community where you live. A good place to start is, you might start by calling a statewide organization like Komen, and they might be able to give you, we do have resources on our website, and then you can find
Specific.
out where in your community are the types of programs and resources that are going to meet your needs. And then once you connect with someone like Helene, someone like Rachel, and others in their organization, they are able to connect you with other people in the community that are going to help to get your needs met. So people should not feel that they're going through this alone. There are a lot of very dedicated both professionals and volunteers out there who are ready and willing to help you.
Wonderful.
I'm very encouraged, and it's been just wonderful listening to.
I don't know about all these things that are going on with breast cancer, so I'm learning, and I think it's great.
I think we're all learning, and there are so many advances and so many changes that are happening. It's wonderful to have people like we've got here today staying on top of, what's the latest that's going
important.
on.
We're all human beings, and we're all different.
That's right.
Yes.
And we have to respect that about each other.
Right.
That not everybody, we all have journeys.
And you
but
can't
they're all
make people
different.
do things they don't believe in or
That's
don't
right.
want to do.
That's right.
That's right.
That's true.
Yep.
Now, our time is just about up. Is there anything else? I imagine there's a lot more you could say.
Definitely.
Always.
I wanted to maybe add, a lot of folks talk about October being breast cancer awareness, and, I have a lot of folks, what can I do to prevent breast cancer? Is there anything I can do? Well, in terms of research data, what we do know is that, maintaining a healthy weight is very important. Exercise drastically reduces the risk of breast cancer, so exercise is important. In terms of alcohol, limiting for women 1 glass a day, 2 to 5 glasses can up your risk by 50%. So it's limiting to 1 a day. And then, they talk about, we went to a conference and they talked about, not much data out there about it, but carotenoids, carrots are good, and vitamin D, there's some controversial studies out there, but definitely maintaining a healthy weight, exercise, and alcohol are the 3 that have been very much identified in studies. So
I'm interested in nutrition, so I'm always reading what to eat for what. How about broccoli?
I think there's nothing that, in terms of studies, the data is still controversial in terms of does it specifically reduce your breast cancer, but maintaining a healthy weight is all about eating a healthy way.
Included.
You know, vegetables and fruits and a quality diet is certainly very important.
I just want to let people know that the center is there. You can call them. They have a fabulous library as well. I didn't mention anything about that, but they do have wonderful resources to help you with any questions as well and guiding you through the journey as well.
You'd make a good buddy.
Yeah.
We are buddies
We are.
from school.
That's right.
Yeah.
From a few years back.
I would just like to remind people again, we have a lot of resources on the Komen, Maine website, and we do coordinate and collaborate with a lot of community organizations across the state. It can be a great place to start, and I'd like to again thank you for inviting us on today so
it's
that
my
we could
pleasure.
share this
Yes,
information.
thank you very much.
One question. Are there any symptoms besides cysts or
Symptoms.
Like,
Well,
do
you know, we just had a talk last night, and we're firm promoters of being breast self-aware, doing breast self-exams, and to do it, the ideal method is laying down with your arm above your head on a pillow and using the opposite hand, using the 3 pads of the 3 middle fingers, doing small little dime-sized circles in a vertical fashion from all the way under the arm, all the way to the breastbone, going up to the clavicle and under the bra line. But it's not just about feeling or palpating, but it's really also about looking and inspecting. So looking at yourself in the mirror is a huge part of doing breast self-exam or self-awareness, and we recommend to do it in 3 positions, looking at yourself with your arms down, looking at yourself with your arms up as well as your arms on your hips, and noticing, getting to know yourself, because what happens when a cancer grows, it invades, so it tends to pull in and bring in tissue. So if you see any kind of dimpling, or all of a sudden the nipple is not aimed in the same direction, or there's dimpling or retraction of any kind, you would want to bring that up right away to your healthcare provider so they can assess the situation. Another thing to look for, I mean, a lot of people say, oh, I have so much pain. Pain is not necessarily associated with breast cancer, but it's something, if it's pain that especially does not go away with your cycle, because we do get lumpy and bumpy sometimes with our cycle, and if pain doesn't go away with the cycle, it's sustained, then that's something I would bring up to your physician. And the ideal time to do those self-exam is between the 6th and the 10th day of your cycle. So if you count the first day of when you're menstruating as the first day, so it would be between the 6th and the 10th day to do this examination as well as the exam. I mean, nipple discharge would be another thing to report. They are some things, the idea is that you find something, do not panic, because the majority of issues are nothing. You know, I tell a lot of my folks who are so anxious about going into the biopsy, between 75 to 80% of biopsies that are done across the U.S. are benign. So right away, you know, the numbers are on your side, that it's not going to be positive. So.
Early identification is, I think, what you're getting at here. And
Correct.
another important tool, as in terms of, there's not only what you can do yourself, but mammograms. anything you can do to make sure that you get,
Your screenings.
You do your
Most
screenings.
definitely. And we do recommend for every woman 40 and above to do a yearly mammogram. There's lots of controversies out there, but 40
Maine is actually above average in terms of the rates of mammography, and that's because we do have some programs out there in the state that will help if you can't afford to have a mammogram done, and we have more than 200 different providers around the state who are participating in this statewide program that will provide access. The best way is to contact someone like Helene. You can call Komen, you can call our Komen, Maine affiliate, and we can direct you to places that you can access the financial assistance for this. But there is help out there if you need it.
That's good. I read a while back that they're not doing mammograms as often as they did.
Well, there were controversies out there as to how many, because there's this group of, they were group of physicians that were hired as a task force to identify, what would be ideal timing for some prevention screenings. And they came up with certain guidelines that a lot of the folks in the breast field do not agree with. So a lot of folks were very confused because all this various recommendations. But we do recommend a yearly mammogram for folks 40 years and above, and then to keep going with the mammograms as long as the individual is in good health. Because we all know that if you have two individuals that are 80 years old, that they could be very, very different. One of them could be at death's door, whereas the other one could be vibrant and active. So it's very individual.
Thank you.
Thank you.
Thank you.
It's been a pleasure.
It has.
It's been a pleasure.
And I
Thank
will
you for
welcome
having
you
us.
back anytime.
Great.
Thank you.
Thank you for having us.
And I learned a lot. So it's a lot to think about, too.
Yes, it is.
Yes, it is.
Thank you again. Well, folks, that is our program for today. I hope you enjoyed it as much as I did. And perhaps you have questions that we haven't answered or I haven't thought of. But thank you for listening. Enjoy the weather. Halloween's coming up, and then after that, October will be history, and we go into November and December, the holidays, and we're all going to be busy. So keep rested, keep well. Thank you for listening. Love, Zaffie. That's it. Thank you.
Great.
My girls in my family, they've had hysterectomies or endometriosis. But no one, knock on wood, my relative have had breast cancer as yet because there's a lot of them.
Well, yes, just keep knocking on that wood.
Whatever works.